Welcome everyone. This is our weekend or weekday meeting with all of my residents. We have 5 residents and they're here for anywhere from 2 to 3 years to learn the methods taught in this clinic as concerns acupuncture and Chinese herbal medicine and pulse diagnosis. So every Wednesday we meet together and discuss cases that the residents might be having trouble with or something that they have a question about. So, Edward, you're up first. This is Edward. He's one of our residents. He's been here a little over a year.
Okay, Bob. So, got a patient by the name Male, and his 50 cat. He has MS.
Okay.
So, my question is just what aspects do we like to focus on, because there's a lot. I mean, there's all neuropathic issues, but what are we good at? You know, what?
Okay, I remember this patient. With multiple sclerosis, you're dealing obviously with a damaged central nervous system, and acupuncture is mediated through the nervous system. So it's always touch and go on what you can actually accomplish with acupuncture with an MS patient. Our success rate with MS, let's say, normally we have I would say a brilliant success rate with almost any kind of problem across the board. With MS, it drops to about, I'd say, 50%. Because most of the time people who come to us are in pretty bad shape. And they want us to sort of resurrect them, and that's very difficult to do. He's in bad shape, and yet he still wanted to enroll in our 4-month plan to try, for us to try anything we possibly could to help him. He's having trouble walking. He's constipated, and he has neuropathy of both his hands and his feet. So we've started his program here just about a week and a half ago. The initial herbs that we gave him were vasodilators because he has very deep pulses. His pulses are deep and they're sluggish. And he doesn't have a weak heart, but he has an inefficient blood flow through his heart. He has a heart murmur, a mitral valve murmur. And when the pulses are very deep, then for sure that means excess dampness in the body, and it means blood stasis in the body. And so to improve this gentleman, you're going to have to strongly move the blood, and in order to do that also, you're going to have to get his heart to pump better. There has to be more efficiency in the pump. So the pump has to be worked on, and all the pipes have to be vasodilated. So we've used some pretty strong blood movers. We have a proprietary formula to this clinic called Vitality, which is basically what I feel is an improvement on the circulation sanjiao that Evergreen sells, which is basically just a combination of Shui Fu Zhu Yu Tong, Ge Zhu Yu Tong, Sha Fu Zhu Yu Tong, and Ji Chong Yin. And then we add leech to it as well, Shui Zhi, and a couple other things. So he was given that formula, and he was given Feng Ji Wang Ji Tong because he has his heart pulse is sluggish, a little clogged up and weak. And Feng Ji Wang Ji Tong is very good in treating these sort of weak pulses from the heart, where there's congestion in the heart, where they have sort of pulmonary congestion due to a weak heart. So that's what he was given. We're waiting to see what happens. We also put in Da Huang and Meng Shao to take care of his constipation. And then we gave him omega-3 oil to deal with the inflammation in his body, and he has a lot of it. This is an inflammatory condition. This is not your typical weak patient. This is a blood stasis inflammatory case. And the acupuncture is designed to treat his neuropathy. And so when you treat him, you always ask, what's worse? It's the hands or the feet? In his case, I remember it was his feet.
Yeah.
So in this case, we'll needle his hands. And he had problems on the balls of his feet. They're numb and they're tingling. So the best place is to needle into basically what I would call the ball of the palm, which is this area. And you can needle all these spots between the fingers, and then also the spots right on the finger, right into the tendon. So you can needle here, 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 and here over on lung 10, and then you can go back and also needle into the tendons. You don't have to needle very deep, because an MS patient you don't want to overstimulate. Now the problem is these are very stimulatory, these needles.
Yeah.
So probably needling both hands is enough that you need to do for this gentleman. If you do more, you can overstimulate an already compromised nervous system, and then you can have problems with the treatment. But I remember he responded well to the neuropathy, so we were encouraged to basically, have him join us. And so we'll keep tabs on him over the next few weeks as we go through these weekly meetings, and we'll see how he's doing.
Well, what if he has his ankles being weak? Things that's similar to drop.
If his
drop
ankle's
foot.
weak, is it weakness or pain?
It's more of weakness.
Okay. If it's weakness, the first thing you can do is you obviously have to ask him where he feels the weakness. And he might not be able to tell you. Was he able to say exactly where it was? Is it on the dorsal side of his ankle?
No, it wasn't able.
He just
Sometimes
feels
it's
weak.
hard for him to.
Okay, since you already have needles in his hand, you can needle all the way across the inside of his wrist. Here, 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 in the heart pericardium and the lung area, and then over in the large intestine 5. You can needle across there and then needle a little bit higher up. Heart, pericardium, lung, and large intestine a little higher up. And see how he feels.
Okay.
If he doesn't, if it has no effect at all, then you can actually go into his foot and you can needle into kidney 1, right into the same foot. Because that kind of a weak ankle can just be neurological only, like a drop foot almost.
Mm-hmm.
And needling into kidney 1 on the same side is very effective, and also on the other foot as well. You can do that. That generally will make the ankle work better. And then you can also needle all around Do20. Just put a lot of needles around Do20 will treats the feet and the ankle
Okay.
by getting through it to the top of the head. Okay? So we'll see how this gentleman does next week or the week after. Okay? Thank you.